I'm not really sure why I'm doing this, but I'm just trying to verbalize what I'm feeling. I love being a nurse. I love what I do. I love taking care of people. I'm passionate about my patients. Never in a million years will I ever say I regretted my decision to be a nurse. Never. It's my calling. Is what I'm meant to do. I'm good at it. That is my calling. I've been a critical care nurse for, I guess, almost 5 years now. And I remember after, orientation, I remember working a night shift, being a new mom, and, in the little breaks that we have, like taking a quick nap and waking up, freaking out, and thinking, my God, I'm responsible for these 2 lives. If something happens, it can be me. I remember feeling that weight on my back, that responsibility. I remember that feeling. And after the years and after witnessing things and becoming more confident in my skills and trusting my coworkers, that feeling goes away a little bit. But this past year, I have seen so much death. I have zipped so many body bags that I could never foresee that. I could never imagine that. And after the first hundreds, I guess, you start going into autopilot, right? You go in there, you do what you can, and that's it. And I commend nurses that are able to keep that face on, move on, and go. Somebody's dying, they're about to die. There is active dying and there is not yet dead. But when somebody's actively dying, I'm sorry, but I'm not the kind of person that is just gonna let that person be alone. So as you can imagine, as I mentioned, there's quite a few body bags. And I feel like even though our brain goes into autopilot in those moments, there are certain times where this needs to happen. There are certain times that we have to be okay to let go so that we can keep our humanity and our compassion. And I think that this is what this is. It's me trying to decompress from another shift. It's me trying to let go of what could have I done? What did I forget? What did I miss? But in my critical thinking, the answer is, I know the answer. The answer is I did everything I could do I've caught every mistake there was to be caught. I did my job. I gave 110% today, as I always do. But in my heart, all that experience, in my heart, it hurts for me to see these people dying from this freaking virus, because it was not up to me. It was up to them. It was up to most of them. And it makes me angry, because I don't even know them, but I care this much. And it's just not me. I know it's not just me, because when you walk around in any ICU, I think in this country, if you look, when we look to each other, we know we are so tired. We are overworked. We are understaffed. And nobody cares. Nobody cares. That's how it feels. Nursing is becoming dangerous. Not only for us, but for the patients as well. Because there's only so much you can do. There's only so much you can anticipate and prepare for when you don't have the help that we need. And we have been talking about this for decades. We know this is coming. People are retiring. We can't keep up. People are living longer, at least were living longer before this virus. As we advance in medicine, so there is more people, there's older people, there are people that are getting sicker because they're living longer, but there is not enough people coming into this field. And nobody cares. I just need to let this all go. And if I decide to do anything with this, I'm not trying to be irrational. This is not a I don't want anybody to worry about me as far as, oh, she's losing it or anything like that. No, I just need to vent. And I want people to know what this freaking pandemic really does to people. I'm just a nurse, but I can't imagine what these families are going through. I can't imagine not being able to hold my loved one's hand when they're taking their last breath, because there's a policy in place that something's gotta give. Something's gotta give, guys. And I understand, and I had the same reservations and concerns about getting the vaccine because I've already had COVID. And I know it's an emergency approval. I know, we all know that. We know that. But look at what's happening right now. I'm telling you what I'm seeing. People are trying to tell you what they're seeing. And it's great to watch the news and watch numbers and the people they're outside of the hospitals. You guys are not seeing this. So I'm begging you, if you have not gotten this vaccine, go do it now. Do it for us. A year ago, all these discount for nurses and promotions and you're heroes and all that. Now we're asking you to be our heroes. We're asking you to help us so we can keep helping you, helping your loved ones. Please, this has got to stop. Nobody should die like that. No, like this. Nobody should. It's unnatural. When a person dies of COVID in an ICU, and I've worked at different hospitals, but I can tell you that in every hospital, in every ICU, if we're capable, if we have the moment, we stay in that room, we take turns, because we don't want that patient to die alone. Even physicians will go in the room to stay with that person so that they can take their last breath with someone beside them. And I know we vowed, we pledged for that. And like I mentioned, I'm not regretting any of that. It brings me joy to be that person at that moment. But there is a point that it starts taking a toll. And this is that moment. This is that moment. So let's do something about this. Please, let's do something about this. We need you to help us. I know you don't want to do it, and I know that. I can understand that. But please, just help us help you.